Hi, I am Dr. Michelle Maddox, and I am thrilled to be here with Dr. Nicole Kane today to discuss a case study for a pediatric patient that she has. First, let me do a little brief introduction. Nicole Kane is an NDMA. She's a naturopathic physician and has a master's in clinical psychology. Her expertise is in integrative medicine and integrative mental health, complex trauma, and mood disorders. She practices in Scottsdale, Arizona, and is currently writing a book about anxiety. Dr. Kane, we're thrilled to have you with us today.
I'm happy to be here. Thanks for having me.
Absolutely. So tell us a little bit about this case.
This is a 12-year-old girl, and we'll call her Amanda. She came to me described as a moody, anxious girl. And she had a really big traumatic event when she was born. It was a really difficult pregnancy and labor. And when she was born, they ended up having to take her to a neonatal hospital by a helicopter. And so she entered the world in a lot of stress. And so she didn't get that skin to skin contact with her mom, that immediate bonding, the looking into the eyes. It was very scary. And so she was in the neonatal intensive unit for almost a month.
Oh, wow.
And of course, at that time, they were giving her just basic formula. She didn't get that colostrum or any of that really delicious probiotic rich breast milk that her mother wished that she could have had. And so her journey started out pretty bumpy, and she was they called her a colicky baby, and it was not uncommon for her to have a lot of emotional distress and gastrointestinal distress, like gas, bloating, irregular stools. And so when they came to me, they were trying to keep her on a pretty strict diet. It was free of all of the things that you think of, right? Like sugar-free, gluten-free, dairy-free, soy-free. They had read things and tried things, and it worked to a degree. Like, she was fairly maintained, but then by the time she is in school and she's entering middle school, and it was really challenging for her to maintain a strict diet. It's
Yeah,
near
of course.
impossible.
Yeah, it's hard for anybody.
Yeah. And it's just no way to live. The kids are bringing in like birthday cupcakes and she can't have it. And they're eating delicious pizza at the fair and she can't have it. And so there's this like emotional mindset of deprivation. So they were on the struggle bus, and she had a lot of anxiety. And I just want to throw a statistic in here because this isn't uncommon to Amanda's story. There's this Center of Disease Control averages over 6 million children have inattention issues, and over 5.8 million children have anxiety disorder diagnoses. And these are just children that are getting reported to the CDC.
Right.
And so it's likely that these are grossly low numbers. And so she's one of them. So Amanda came in, and we did a lot. We did a lot with her. And the reason we're having this conversation, you and I, is because one of the things we did use was Psychobiotic, which is a probiotic that has been tailored to actually affecting the brain, the gut-brain axis. And our target for her was two goals. One is to relieve digestive distress, and two was to try to reduce anxiety.
And what was the psychobiotic and what was the dosaging strategy that you used?
My jam is Omni-Biotic stress relief. So actually she has been really reluctant to take anything because she's been on supplements for as long as she can remember.
Yeah.
And so her mom's hiding pills and things and all of the things, like as they do. And one of the cool things about the Omni-Biotic product, the stress release, is that it comes in a sachet, a little powder packet, which dissolves in water, and it doesn't really have much of a flavor. And so it was really easy to get into her. And she was really down with smoothies. And so we mixed it in water, and then we put it in a little bit of like chocolate milk or something like that, and make it tolerable for her. And she did well. There was another reason that I was excited about that. So years ago, I did genetic testing, and she has a mutation on a gene called ACADS.
Okay.
And what that gene is it's acetyl coenzyme A dehydrogenase, which is involved in fatty acid metabolism.
Okay.
And so what would happen is that she would often experience symptoms of low blood sugar, and then she would go into a rage. And
Oh,
so she's like crashing and going into
yeah.
a rage, but she wasn't a candidate for insulin or glucose
Yeah.
tabs or anything like that. She just isn't processing fatty acids very well.
Okay.
And I was looking for beneficial bacteria, thinking about going to the gut and knowing that short chain fatty acid metabolism often starts in the gut.
Mm-hmm.
And Omni-Biotic has some really cool research into their products. And that's one thing that when you're picking a probiotic is to make sure that the strains from the manufacturer are actually clinically researched.
Yeah. The product itself has research on it in humans.
In humans. So it takes it out of theory into
Yeah.
actual human studies, and Omni does have that. And so I was excited about that. So we tried her on it, and we started low because she does tend to have a lot of reactivity. So I actually started her on a quarter of a packet
Oh, wow. Okay.
every day.
Mm-hmm.
And she slowly started improving. And
Mm-hmm.
so I've had some patients where I've used probiotics. Like we did another one of these where she was like better in 2 days. And that was
Right.
the most amazing case I've seen. This one was a little bit more complicated, a little bit slower of a progression, but there has been clear and marked improvements. And so more specifically is her subjective experience of abdominal pain
Mm-hmm.
is better. So I asked her, how is your tummy pain? How is your stomach feeling? And she said
Right.
it's better. And then we also just assess how often she complains to mom about her stomach pain, because
Yeah.
she's quite a verbal
Because she's
human.
12. Yeah.
She's 12. She says all of the things, and mom
Yeah.
says she's been complaining much less.
Oh, that's
The
good.
other objective measures that is good is that they're very open about stool in that
Mhm.
house. And
Mhm.
so Amanda goes to the bathroom. Mom's like, how did it go? And the stool is much healthier, is more well formed. She is feeling like she's having better bowel movements. Like
Mhm.
she feels like she's done when she's
Right.
done, as opposed
Yeah.
to before. It's like, I got to go back and try again.
Yeah.
So the stool looks better. Her experience of having a bowel movement is better. Her pain in the abdomen is better. And her crashes in blood sugar are actually better too. And so what we were doing before is we had to give nurse a letter that she could carry around little granola bars and snacks in her backpack,
Right.
because she just was like starving and ravenous.
Right.
And now she's not needing to utilize that as much. She's finding that she can go longer periods of fasting, which is really a huge victory for her.
That's awesome. Are you doing any other GI repair, any other GI protocol specifics for her?
We've tried other things in the past, and the challenging part is she positively responds to things, but she won't continue to take it.
Mm.
It's just either disgusting to her, or she can't swallow pills very well. She's still really quite young. She's a champ at swallowing things, but I don't feel like we've had as much consistency with other things to really assess, like, was this that one piece that we really needed?
Mm-hmm.
The only other thing that we've been able to be really consistent with is homeopathy, but the remedies are working better with the psychobiotic, the stress release on board.
Nice.
It's like significantly better. She's more stable. We change the remedy less often.
Mm-hmm.
So the two together are marrying really quite nicely.
It's really interesting when you find the psychobiotic, which is it's working on the physical body, but it's also working on that mental and emotional and a little bit of a different body, marries so very well with homeopathy, which is working with the physical body, but also again on that mental and emotional, and things are just a little bit less tangible. It's always interesting when you find how well those things work together.
I often describe it to patients as a car. You know, if you have a car that was in a collision, you got to change each of the 4 tires, flat tires. And So one tire is the gut healing, another tire is stimulating the body's natural healing ability with homeopathy, and then a third tire is nutrition, and a fourth tire maybe if she's just not breaking things down, maybe she needs an enzyme. But I really like how we can marry different supports together. And so oftentimes people will tell me, oh, I've tried probiotics before, or I've taken remedies before and it didn't work for me. But oftentimes it's because the emergency brake is on and you're trying to drive. Mm-hmm. There's an obstacle to cure. So we have to change out all four of the tires, take that emergency brake down, and then hit the gas, and then you'll start progressing. So someone's listening to this conversation like, well, good for her. She took a probiotic and felt better. It's not always that easy. It's about, she's done work since, her mom brought her to different doctors for her whole life, but it's like, now we have the right pieces on board, and now we're seeing progress.
Nice. And have you done any objective testing, any stool testing or anything with her?
We haven't, just because she's so young, and I talked to mom about doing stool testing with her, and mom's like, nope, absolutely not. She won't do it. So that is like in my heart of hearts. Like, I want to do a baseline test. I want to do my psychobiotic, and then I want to do follow-up testing. So stay tuned. If I can get her to submit a stool sample, it will be the joy of joys.
It's always interesting to me when people are like, I'm not doing stool testing. I will talk to you about it all day long, no problem. But that's as close as we're going to get. I'm not doing anything else. It's amazing.
It's coming out of you anyway. Just put it in a cup.
Yeah. It's not a big deal. It's really easy these days. Have you done, what other pieces of therapy do you have on board with her? I heard homeopathy and I heard the psychobiotic. Are you still working with her on her nutrition?
Nutrition for her is really, really difficult. So she will go through phases where all she wants to eat is sushi, and then she won't eat anything else. And then she'll go through a phase where all she wants to eat is hot sauce with chips. So I feel like this particular sweet soul has been on so many diets that she's just over it, and she wants to eat what she wants to eat. So ideally, as a naturopathic physician, I'm like, let's make sure that she's getting in like leafy greens and anti-inflammatories and omega-3 fatty acids, and like all those wonderful things to propel her to greater health. For this particular person, it just isn't simply an option right now. So we do what we can.
Have you seen any differences in how she responds to food since starting the probiotic?
In terms of like stomach aches and gas and bloating, absolutely. Also in terms of blood sugar stabilization, absolutely. So she's able to fast for longer periods of time, snack less, her stomach is getting upset less. In terms of, did she really have a gluten issue or a dairy issue? The jury's out for that one, because we're so intermittent in terms of she's getting it in, but mom's trying to limit it, that it's unclear. But that being said, she is tolerating what she's getting in better, and she's by no means following any sort of a diet. She's just like going for broke and having a great time right now.
Which, she's 12. You want her to have the freedom to do that within reason.
Living her best. Yeah, living her best life right now.
And has mom, or has she reported, she's having fewer of those dips? And so how is that, that rage that she was reporting and that you were talking about, how's that going?
So much better. It's so much better. In fact, she's interested in studying psychology now.
Oh, so nice.
She's been watching a lot of YouTube videos and like learning about mental health. And she's so interested in mental health because she feels so much better.
Yeah.
Part of the work that I do with is, it's really important to me. It's a naturopathic tenet. It's docere, which is physician as teacher.
Right.
And so a lot of the time that I spend with her is like, she's 12, but I spend most of my visit communicating with her and working with her and empowering her. And that's been really cool. So while she's like kind of reluctant, she's incredibly reluctant, let's be real, to make dietary changes, she is really open to have a conversation about like, this is what my body does when my nervous system is getting activated. these are the coping strategies that I need to use, and look at how I feel better. And I'm not having outbursts at my mom, and she hasn't broken anything, and she's doing better in school and not fighting with the kids as much. And she sees that. And so she's like all into the psychology now.
That's awesome.
Yeah.
That's a really huge piece of it, to have that connection. I know adults who don't have that connection and
Oh,
level of
man.
awareness.
Oh, when I was her age, I had no clue. Like the
Yeah.
kids these days growing up in the information world, it's just really amazing to see like what they can understand if someone just spends time to share it with them.
Yeah. Yeah. On that note, on kind of this adolescent medicine type thing, how do you work your visits with her as far as mom present, not present, her time with you just by herself, etc.?
I always split it into two parts. And this is one big thing. So if there is a parent that listens to this, and if you're taking your child to a psychologist or a counselor or therapist, it's a big red flag if they're not involving you in therapy. And so you should be involved in every single visit. And so the way that I negotiate that is it really depends on the kid. But I've been working with Amanda for long enough where she and I have a great rapport. So she'll come in and I'll spend 20, 25 minutes with her. And then we'll bring mom in and we'll finish the session with mom. And oftentimes, every time I make goals with them, I'm like, okay, this is what let's make some goals together, and they'll come up with it. And then I have them explain everything to the mom. And so Amanda's gotten really good at that. So we'll be like playing in the sand tray. I do a lot of sand tray therapy. And she'll be like, I'll be like, okay, well, we have 10 minutes, so we got to grab mom. And she's like, got to make goals. And I'm like, all right, what are your goals going to be? And so a lot of it's just like training her so that she can work with mom, and then mom can try to reinforce. Like we recently did a clockwise, counterclockwise exercise where we put the sand tray out. And the sand tray, for those who aren't familiar with that, is just literally like a big sandbox that I have in a big Tupperware thing with a lid. And then I have a big bin with all sorts of different toys and figurines. And so I have like little cats and little mushrooms and a snake and like an angel and like all these different figurines. And it's kind of like a Rorschach in a toy. And so then we'll talk about something that's bothering them or stressed. And so she was having a lot of frustration in school with this particular boy, we'll call him Christopher. And we kind of had her make a sand tray of like all the little characters in our classroom, and she kind of described it, and then we had her look at it, and then we looked at the stress. And so then I had her take a little shovel and we drew a circle clockwise, and she imagined reorienting that classroom to feel confident, like, oh, I'm looking around and I feel really good. And we used this physical gesture and the touch of the sand. And then we did the opposite. We went counterclockwise. I'm like, oh, I feel nervous. I feel insecure. Christopher's bothering me. I feel like he's judging me. And we practiced that. And so then when mom came back in, we taught mom how to do that. So then they were playing in the yard at home in the dirt there and do clockwise, counterclockwise to build confidence.
Nice. It's a really nice way to bring in some kinetic aspect to it, which is huge with that adolescent population.
Yes.
Yeah. Nice. So
it was fun.
Is there anything else about the case that you want to make sure that we discuss?
Let me see. I think that a couple of things in terms of like risk factors are, again, is that she didn't have that original microbial gift. And, so when we're thinking about, so if I'm a parent and I'm thinking about, okay, should I get my kid in? When, like, are probiotics going to be helpful? When should I start probiotics? Is that generally speaking, your microflora is given to you when you're born and when you nurse, and from dogs licking you and people kissing you and whatever, like all this time you're getting all this microbial diversity. And when we're in our early teens, like right now, Amanda's age, like this is the time to like really solidify that commensal bacterial community that lives in your body, because that's going to stay with you for the most part for the rest of your life. And as an adult, we can affect change. Like your bugs will change with every meal that you eat. They change up really quickly, but like generally speaking, like that's your foundation of gut. And so especially with adolescent health and with this case, is I really truly think that getting a probiotic on board that she was willing to take and take consistently, that is addressing like her particular needs, is really important, especially at this developmental age, to set the stage for health for later.
Mhm.
And so anybody who's listening to this, if you have a young person and you're wondering if it's a good time to start, the answer is probably generally yes.
True. Very, very true. I do want to make one little caveat around the how we build our microbiome. We do want to protect our children from random strangers kissing them and like fingers on faces and so on and so forth. But it is how they do build their microbiome, right? They go play in the dirt. They play in the sandbox. A public sandbox at the playground kind of a thing, right?
Yeah.
And who knows who was in that and what was in that. And so it's all of those tiny little micro interactions with the outside world that helps to inform their definitely their GI microbiome, but also their oral microbiome and their skin microbiome and all of those other microbiomes that we have, not just the gut. But it's a huge point of all of these little things that sometimes, I think, definitely pre-pandemic, most people never even thought about it. Post-pandemic, I think we're not post-pandemic, but wherever it is that we are right now, I think people are slightly more aware. However, there's this interesting interplay of everywhere that you go, you're being exposed. And some low level of exposure is actually really, really good. It helps build that gut microbiome and it helps build your immunity, obviously within reason, right? But definitely.
Which she was missing in that first month of her life, that she was in such a sterile environment. And I think you raise a really interesting point about the effect of the pandemic and this, everybody's washing everything. And yes, of course, you don't want to like lick somebody who's got chicken pox, or they haven't washed their hands or whatever. Yeah. So like being mindful of it, but there is this, I feel, a pendulum swing, like where we're going back to this old mentality that germs are bad. And we, as a civilization, we have gone through that. We like discovered bugs. We thought bugs were great. And then we realized there's a relationship to health and disease. We tried to kill all of the bugs and that was problematic.
Right.
And so now it's like, how do we find this nice balance, like you're saying, of healthy exposures and not bad exposures causing disease?
Yeah. And definitely that help with the targeted and the very specific and intentional supplementation with a psychobiotic, if that's what's most appropriate for a particular individual to help boost their natural exposures and influence those. Yeah. Was there anything else about the case that you were wanting to share?
I feel like those are the high yield points, and there's going to be a write-up about it. So if somebody wants to learn more about this specific case, I did publish a case and it's going to be coming out in NDNR. And so you can read more about that.
Awesome. So that's the Naturopathic Doctors News and Review, and you can get it on their website, right?
Yes.
If you don't do the paper. I don't know that they do the paper anymore, actually.
I don't know either. I don't know.
Oh, so that's great. I look forward to reading the case study that you published on this one as well.
Yeah. Thank you, Omni, for helping Amanda.
Yeah, absolutely. And thanks, Dr. Kane, for being with us today. It was a really great conversation, and I look forward to more of these case studies with you.
Thank you for having me. This was fun.